Vaccinations are an important part of keeping our children and ourselves healthy and free from debilitating and often deadly diseases. My name is Sheila Blevins. I'm a mother, grandmother, and a nurse, so I understand the importance of being vaccinated against diseases. Being vaccinated means that the body's immune system is programmed to fight off any type of bacteria and viruses that can cause diseases, such as polio in the 1950s, when there were over 58,000 cases in 1 year. With the advent of vaccinations, we as a society have been afforded protection from illnesses, a decrease in crippling diseases, and the elimination of some deadly diseases. Smallpox has been around through much of the history of mankind. It was known that smallpox survivors were immune to the disease, but not why. On May 14, 1796, Edward Jenner used the fluid from a cowpox lesion from a dairy maid to inoculate James Phipps, an 8-year-old boy. Phipps developed mild fever and discomfort. 9 days later, he felt better. In July of 1796, Jenner inoculated the boy again using the fluid from a fresh smallpox lesion, and no disease developed. Jenner attempted to publish his research, but it was rejected by the Royal Society. After adding a few more cases to his initial experiment, Jenner published his research privately and gave his procedure the name vaccination from a combination of the Latin words for cow, vacca, and cowpox, vaccinium. Jenner went to London in search of volunteers to test his new vaccine, but with no luck due to vaccination already becoming popular through the activities of others, particularly Henry Klein, who Jenner had given some of his inoculant. Jenner conducted a nationwide survey in search of proof of resistance to smallpox, and the results confirmed his theory of immunity. With the widespread use of smallpox vaccine, smallpox became eradicated under the guardianship of the World Health Organization in 1977. On May 8, 1980, the World Health Assembly announced that the world was free of smallpox. Since that first vaccine, others have been developed. The vaccine types available today include live attenuated vaccines, inactivated vaccines, subunit, recombinant, polysaccharide, and conjugate vaccines, and toxoid vaccines. During the 1950s polio epidemic, nearly 58,000 new cases were reported during 1952 in the U.S. alone. The development and subsequent release of a vaccine by Dr. Jonas Salk decreased the number of new cases to under 6,000 by 1957, when the vaccine was widely available. And as you can see, by 1960, there were just barely over 3,000 new cases. Vaccines are safe and effective. Testing and evaluation of every vaccine occurs prior to being licensed by the FDA and being recommended by the CDC. During clinical trials, a vaccine is tested on volunteers who get vaccinated. These trials start with a small amount of people and work up to include thousands of volunteers, and these tests can take several years. Each batch is tested for quality and safety. Manufacturers test batches to ensure that they are potent, pure, and sterile. After being released to the public, the FDA, the CDC, and other federal agencies continue to monitor for safety. In a study done in 1998 by Andrew Wakefield, he claimed to have found a link between the mumps, measles, and rubella, or MMR vaccine, and the occurrence of autism. It was discovered that the lab that Wakefield had used had been contaminated with the measles virus RNA, but those that believed Wakefield dismissed those findings, made a martyr out of him, and claimed that the evidence was a conspiracy. During further studies and reviews of Wakefield's data, it was discovered that Wakefield had applied for a patent for his own MMR vaccine substitute and treatments for his alleged MMR vaccine-induced gut disorder. Wakefield had been paid by lawyers to cast doubt on the current MMR vaccine in use. Even with the autism link being disproved, attention then turned to a mercury-based preservative found in some vaccines, which is called thimerosal. Evidence had been accumulating that autism is a genetic disorder, and it's typically diagnosed between the ages of 2 and 3 years old, and that's usually after those first vaccines are received. Many people still fear autism and are refusing to get their children vaccinated. Many of these people are falling under the influence of Hollywood celebrities and are failing to look at proven medical science. And these people are called the anti-vaxxers. Pockets of unvaccinated children are emerging in the United States. These unvaccinated children are not protected, and they're being opened up to contracting these debilitating diseases. Polio has emerged in countries such as Afghanistan and Pakistan, where many of the population are unvaccinated. So far this year, there have been 19 cases of wild polio virus that have been diagnosed. As of September 8, 2018, the CDC had confirmed 137 individual cases of measles in 24 states and the District of Columbia, with a total of 11 outbreaks where 3 or more cases were linked. The majority of these cases were unvaccinated people. There are those among us that can't receive vaccines for multiple reasons, such as having a compromised immune system, as seen with some birth defects, and with cancer patients. To protect this population, it's important for those around them or those that come in contact with them to be vaccinated to provide herd immunity, which is a form of immunity that occurs when a significant portion of a population has been vaccinated. And that's going to provide a measure of protection for those around them. In conclusion, vaccinations are important not only for the individual, but for everyone in order to provide protection from debilitating and deadly diseases. With the development of the first vaccine, diseases such as smallpox have been eradicated, and others have been dramatically reduced among the vaccinated population. Vaccines have been proven to be safe to receive through extensive testing and continuous monitoring. The link between vaccines, primarily MMR, and autism have been disproved, and the claim has been proven to have been falsified for personal financial gain of Andrew Wakefield. With growing pockets of unvaccinated children, we're seeing an increase in preventable diseases worldwide. I hope that the information I've presented has helped to increase their awareness of the importance of vaccinations and the prevention of diseases and illnesses.